Hello, this is Dr. Curtis Wolf again. Today I wanted to talk to you about hypertension or high blood pressure. There's a lot involved in high blood pressure. We're going to try to keep it simple and hopefully shorter than the last video. What is the definition of hypertension? It depends on your age and your risk factors, what we consider hypertension. But for simplicity's sake, we're going to say, for most of you, high blood pressure is going to be any blood pressure over 140/90. We talk about systolic blood pressure, that's the top number. Diastolic blood pressure is the bottom number. Both of those are important. People often ask me, what are the symptoms of high blood pressure? And unless your blood pressure is actually very high, you will usually not have any symptoms of high blood pressure. People come in to me feeling fine. I tell them they have high blood pressure and they don't believe me. How can I have high blood pressure? I'm feeling fine. And then worse, I put them on medications that sometimes have some side effects so they feel worse. And they ask me, why are you doing this to me, doc? So that brings up the question, why do we treat high blood pressure? The reason we treat high blood pressure is to decrease the risk of vascular complications, namely heart attack and stroke. We also worry about high blood pressure causing renal disease, eye disease. It can affect all the organs of the body. But high blood pressure is a silent killer. You won't have any symptoms of high blood pressure until sometimes you have these big events, a heart attack or stroke. So your risks for these vascular complications increase linearly with any blood pressure above 115/75. So anything above that, your risk for heart attack and stroke increase. For every 20 millimeters systolic, the top number, and for every 10 millimeters diastolic, the bottom number, the risk for heart attack or stroke doubles. So when people come in with a blood pressure of 140/90, which is usually the level where we start treating high blood pressure, your chance of a heart attack or stroke has already doubled at that time. People will often come in and ask me, well, how did I get high blood pressure? Like diabetes, a lot of it has to do with our lifestyle. Being overweight increases your risk for high blood pressure. Not exercising, alcohol intake, smoking, too much salt increases the risk for high blood pressure. But a lot of times it's genetic. If your parents have high blood pressure, there's an increased risk that you're going to have high blood pressure. And then your age increases your risk for high blood pressure. I have actually very few patients over 70 that don't have some degree of high blood pressure. People have always had high blood pressure, but they also died a lot younger than we do now, on average. And so we're really, when we're treating your blood pressure, we're kind of working against nature. Nature wants us to die, and we're trying to prevent that. So what are our goals for treating high blood pressure? For most people, the goal will be to get that blood pressure less than 140/90. For people over 60, we give them a little bit more leeway. It's, for most people, if they don't have other risk factors, it's okay to have the blood pressure up to 150/90. If you have diabetes or renal disease, we get a little bit more aggressive treating high blood pressure, particularly because that can affect the kidneys. So for most people with diabetes or renal disease, we want it less than 130/80 if we can get it that low. So how do we treat high blood pressure? Everyone with high blood pressure should probably adopt some lifestyle modifications. Weight loss, exercising. Even if the exercise is not causing you to lose weight, the exercise by itself will help your blood pressure to go down. Decreasing your alcohol consumption, quitting smoking, decreasing stress. That's one of the hardest things for us to do. And there's something called the DASH diet that we recommend. That is the diet approach to stop hypertension. I will hopefully put a link on here about the DASH diet, but it is a low sodium diet. There's lots of fruits and vegetables, moderate meat, a low sugar diet, and that's really the diet we really all should be on, but most of us aren't. Medications for high blood pressure. For most people, there are actually four different types of medication that we will usually start for high blood pressure. They are thiazide diuretics. Some of the ones that we often use are hydrochlorothiazide or chlorthalidone. Calcium channel blockers, the one I usually use is called Norvasc or amlodipine, or ACE inhibitors. ACE inhibitors all end with the sound pril, like lisinopril is the one I usually use. The ACE inhibitors can sometimes cause a little tickle in the throat and a cough, and if people get that, that's about 5% of people will get that, then we'll change them to a similar medication called angiotensin receptor blockers, or ARBs. And some of those are Cozar or losartan or Diovan or valsartan. Which one we start depends on risk factors. African Americans tend to respond better to thiazide diuretics and calcium channel blockers than the ACE inhibitors or ARBs. If somebody has diabetes or renal disease, we will usually want to start them on an ACE inhibitor or ARB because they help protect the kidneys. Also, if someone has heart disease, have had a heart attack or any type of blockage in their heart or even congestive heart failure, we will often want to have them on a type of medication called a beta blocker. Some of those are metoprolol or carvedilol, and this protects the heart against dangerous arrhythmias, among other things. If you show up to our office and your blood pressure is above 160/100, we're probably going to want to start you on 2 different medications because it's going to take usually at least 2, and it's not uncommon for me to eventually need to have people on more than 3 medications to control their blood pressures. So as I stated before, high blood pressure itself doesn't usually have any symptoms. People usually feel fine if their blood pressure is a little high. Unfortunately, a lot of the medications can cause side effects. The most common one with ACE inhibitors are a cough, a little tickle in the throat, as I talked about before. Both ACE inhibitors and ARBs, in rare cases, can cause swelling in the mouth and the lips, which can sometimes be dangerous. I've seen that just a few times. Thiazide diuretics can make your potassium go low. It can cause cramping. If you've had gout, then we don't usually want to have you on a thiazide diuretics because it can make gout worse. People on calcium channel blockers will often have swelling in their legs and feet. Beta blockers are another type of high blood pressure medication, and they can cause some shortness of breath, fatigue. They can make asthma worse. When it becomes difficult to treat high blood pressure is when people don't tolerate these medications. They'll have the common side effects from every one of them. And then it becomes a little tricky. We have to kind of play around, find out which ones they're going to tolerate the best, and sometimes we have to go to 2nd or 3rd tier medications to get their blood pressure under control. What about people who have resistant high blood pressure? We put them on a lot of different medications, try them on things, and the blood pressure doesn't come down. Sometimes that is because they have what we call a secondary cause of high blood pressure. I'm just going to talk about 2 of those secondary causes of high blood pressure. One of the most common ones is sleep apnea. So if I put them on a lot of different blood pressure medications, can't get their blood pressure down, I'll often send them for a sleep study to see if they have sleep apnea. Another common cause is something called hyperaldosteronism. If we find somebody has this, we will put them on a different type of diuretic or water pill called spironolactone, and they will usually respond to that. If we can't get people's blood pressure under control with the common medications, we will often have to use secondary medications. Some of those that you might have heard of are clonidine, hydralazine, or alpha blockers. They tend to have more side effects, so we don't usually use them as a first-line medication, but sometimes we have to use them. So I hope this helps you better understand what's going through our minds when we're treating your high blood pressure. We're treating your high blood pressure because we love you and we want you to live as long as you can. And so I hope this helps, and I thank you for watching.